On to our top story. Zimbabwe is appealing to individual citizens and local companies for $35 million to help fight a cholera outbreak that has killed 31 and infected more than 5,000 people. That's according to Finance Minister Mthuli Ncube. Earlier today, Zimbabwe's President Emmerson Mnangagwa visited Harare's Glenview Township, the epicenter of the outbreak. He met patients and families who lost relatives to the disease. The worst cholera outbreak in a decade has exposed the problem of a decaying urban infrastructure. Mnangagwa says his government would help the opposition-led Harare City Council to replace aging water and sewer pipes after government officials and the opposition blamed each other for the outbreak. Police this week started clearing illegal vendors from Harare streets, saying this was part of a drive to bring cholera under control. For more on the cholera and Ebola outbreak on the African continent, we are now joined from our Pretoria studio by Dr. Brian Chirombo, Acting World Health Organization representative to South Africa. Dr. Chirombo, thank you so much for joining us on The Globe. Now, let's talk about the cholera situation in Zimbabwe. The last update from the WHO was that this waterborne disease was spreading fast. Why has containment been so difficult?
Thank you very much for giving me the opportunity to talk about cholera on behalf of the World Health Organization. Could just start off by just highlighting the status of cholera in Zimbabwe. As of the 10th of September, 2006 suspected cases have been reported since the start of the epidemic on 4 September 2018. The confirmed number of cases have been 73. Relative deaths have most recently been reported as 37. To respond now specifically to your question, there have been challenges with distribution of clean water, household use, affected areas, particularly in Harare, which is the most affected area. And also there have been challenges with the sewage systems in the affected areas in coping with the population and the needs need to be upgraded. At the different levels have been working on this, and we understand that the situation is, so it is being addressed, but this has been part of the main reason why the epidemic has spread so quickly.
Outbreaks are not new to Zimbabwe. In 2008, thousands of people died from cholera. How different is the current outbreak from what we've seen before in Zimbabwe?
The current outbreak, we have seen the government has been quite transparent, and government has responded. For example, they informed very quickly the World Health Organization on the outbreak, was noted, declared it an emergency in the Harare area of September, very soon after the outbreak had broken out. And so, quite quick from partners, and has developed an emergency multi-sectoral cholera outbreak response plan of the World Health Organization and other partners. Implementation of this plan that includes both addressing public health issues, medical issues, water and sanitation and hygiene interventions, supported mainly from government, so government resources have been put in. Resources have been pulled in from private sector, from civil society, from NGOs, other partners. So when you look at the difference with 2018, at that stage was facing major economic challenges on the health system. Resulted in the country having a lot of challenges. So it is quite different this time because of the response has been much better and the systems have improved thanks to the work that government has been doing.
Speaking of challenges, one of the issues highlighted in this particular crisis is the ineffectiveness of the antibiotics initially used to treat cholera patients. Why is there resistance to these drugs?
The first thing I need to emphasize is that the most important thing for patients is actually to be put be swiftly rehydrated with fluids. And for those who have mild disease, that can be done orally, where they can take the fluids. Who are more sick, it will be given intravenously. Critical part, they will help in terms of the treatment package. Even if a person is not given antibiotics, they will get better. So yes, there is antibiotic resistance. This may be caused by overuse of antibiotics in the past, so this is not something that happens overnight. Because there were inadequate doses of drugs used in treating infections, and sometimes people not completing their treatment. So it is to do with resistance. The thing is to say that the still need to continue on rehydration. And then antibiotics can also be used, because the bedrock is really the rehydration.
Now, Dr. Chirombo, let's shift focus now and move to the DRC, where the WHO is also fighting an Ebola outbreak there, where there seems to be difficulty in containing the outbreak for different reasons. Obviously, what's the latest there? What exactly is happening in the DRC with regards to Ebola?
For the DRC, we are seeing promising trends. At the original epicenter was Mangina. We're actually seeing positive response is to work well. The number of cases in this rural area have to significantly have gone down. Of course, we can't yet say this outbreak is under control. Some concerns in some more geographic spread of the outbreak to sample of approximately 1 million people. There has been occurrence of some more cases among contacts that have lost or avoided follow-up. We can be sure traced every in health zones and vaccinated them and their contacts. Our guard down. 18th of September, a total of 140 cases have been reported, 109 of them confirmed and 31 probable, and there have been 94 deaths, 64 of which have been confirmed and 31 probable cases.
Now, let's speak about some of the challenges. I understand in some areas there's a huge problem with regards to mistrust among a local community. How is the WHO able to deal with this problem to ensure that your approach to dealing with the outbreak in the DRC is effective?
Yes, as you would understand, responding to Ebola is is always complex. In the North Kivu area, particular challenges because the outbreak has actually occurred in a zone, some security issues. And there is also, as I mentioned, Butembo, density areas, and some mobility. Of those elements hamper the response. Virus spreading. In an area, the initial epicenter of the epidemic, not really a high security area, but as the epidemic has spread, it's moving to some areas where there are security issues. For example, the area where it's beginning to spread between Beni and Oicha, an area where security is very high. So in that area, it could be a bit more challenges. But however, the UN, WHO working with the UN security, place with an epidemic in an area of
Dr. Chirombo,
So
unfortunately I have to come in there and just cut you off. We have run out of time, and thank you so much for joining us this evening on The Globe. That was Dr. Brian Chirombo, acting WHO representative to South Africa, joining us from our Pretoria studios. Now, in other news, the Commission of